I think we'll go ahead and start as we wait for more people to join in. They'll join in along the way. We have 1 hour. We shall go right ahead and start. I want to welcome all of you to our second webinar of the Uganda Health Informatics Association. My name is Carol Kamasaka. I am the president of the association, but also a digital health specialist working with Ministry of Health. The theme for today's webinar is the use of digital technologies to build capacity of health professionals in lower and middle income countries. This is in relation to the Helena conference that is supposed to be held next year. It was supposed to happen this year, but because of COVID, we have had to reschedule it to early next year. Proposed dates are in March 2021. Our webinar has been organized by INFORMATICS Association, Ministry of Health, and Helena in collaboration with the World Food Organization, World Food Program, UNICEF, USP, Living Goods. Allow me right now briefly introduce our panelists for the day. I'm going to share a slide that has the bio of our panelists. We have Mr. Paul Mbaka from Ministry of Health. Paul is a data scientist with a Bachelor of Statistics and Computing. He also holds a Master's in Statistics. He has training and vast experience in monitoring and evaluation, burden of disease estimation, project planning and management. His experience also spans across software and database development, epidemiology and disease surveillance. Paul is currently working with the Ministry of Health as a Health Information Technical Advisor, but also the Acting Assistant Commissioner Health Services for the Division of Health Information. Paul, you're welcome. Our next panelist is Mr. Moses Vajendera from UNICEF. Moses is a health information systems specialist working with UNICEF Uganda. He holds a Master's in Computer Sciences from Central University, China, a Master's in Public Health Informatics from Atlantic University in the US. He's also currently pursuing a PhD by research at the University of Luxembourg in partnership with Macquarie University, with interest in interoperability of data use and utilization in healthcare institutions in Uganda. Moses has also worked with the World Health Organization as a public health informatics specialist. This was prior to his joining UNICEF. Our next panelist is Nathan Natiseri, working with WHO. He holds a Bachelor of Statistics from Macquarie University, a Master's in Computer Science from the UK. He's a certified Microsoft Systems engineer. Nathan works with WHO and is in charge of monitoring and evaluation of population, health and nutrition programs by measure evaluation, advanced geographical information systems, and numerous capacity building. Is also in charge of managing numerous capacity building workshops and conferences, both local and international. Nathan has 2 years experience of working with the health sector, 16 of which have been at WHO. He has served in various capacities at different times, including statistician, network administrator, data analyst, data manager, and M&E advisor, and mainly focusing on HMIS and ISDR, seeking to strengthen IDSR and health management information systems to enhance epidemic detection and prediction, monitoring trends of endemic diseases and disease-specific interventions, as well as different program-specific M&E aspects and capacity building. Nathan, you're welcome. Our next panelist is Jamir Mpima from World Food Program. Jamir is currently working with the United Nations World Food Program, leading digital health governance and implementation, in addition to general data management activities. He's a health informatics professional with a clinical background. He previously was working with Ministry of Health, where he provided technical advice on e-health. He has participated in various e-health initiatives, particularly development and implementation of digital health global goods, both nationally and globally. He comes to share experiences and practical lessons learned on how digital technologies are strengthening the performance of the health sector. And last but not least, we have Cedric Anil Moheba from UNFPA. Cedric is an ICT specialist, passionate about harnessing ICT and innovations in reproductive health. His 10-year career possesses skills and experience in directing operations, establishing workflows, business systems analysis, youth skills development, and innovation. Cedric is currently the program analyst for social change innovations at UNFPA and provides leadership in the development and implementation of social change innovation strategies aimed at improving the efficiency and effectiveness of delivering high impact outcomes. He has previously served as head of social franchise and strategy at Maristops International. He has also served as an information systems manager and mobile technology lead at the same organization. Previously, he worked at Centenary Bank and NITAU and the Parliament of Uganda. Cedric, you're welcome. Lastly, allow me to introduce our moderator today, Ms. Sheila Mutheu. Sheila is a digital health partnerships manager working with Living Goods. She has a decade years experience in the design and implementation of digital health program initiatives under maternal and child health, working jointly with country governments, donor organizations, and implementing partners in Africa. As a technology advocate, Sheila has participated in global forums, spearheading the agenda on digital health for sustainable impact. Sheila holds a bachelor's in business technology from Stratham University, a master's in global business administration from the United States International University in Africa. Sheila, you're welcome. Before we go right ahead and start our webinar, allow me share some house rules. Our webinar will last an hour. Our panelists will have 30 minutes of discussions, which will be moderated by Sheila herself. The audience is kindly requested to post their questions in the chat room. We'll also have Helena come in, and we shall allow them to give a few remarks. Thank you very much. Sheila, over to you.
Thank you, Carol, and welcome once again to you all. So now I'd like to start off the conversation in building the context with Paul Mbaka walking us through on what the sentiments of the use of digital technologies in building capacity for human resources for health in lower middle income countries as an integral strategy within the public health system. Mr. Paul Mbaka.
Thank you very much. Colleagues. I'm all protocol observed. I am happy to be here this afternoon. I hope you can all hear me very well. In these days of online meetings, you can never escape a bad internet link, but I hope I'll be able to communicate accordingly. So mine is a very simple one to articulate what the sentiments are towards deployment of digital health digital tools to facilitate training or capacity building, for that matter, for health professionals. So in the context of Uganda specifically, and I think generally Africa at large, most of the countries in these contexts are resource constrained. So having mechanisms for delivering cheap training, or at least training that is at a low cost, is something that countries, and specifically Uganda, has an appetite for. In the upcoming digital health and health information strategy for Uganda, models of capacity building that leverage on technology is definitely going to feature prominently. Of course, we know that traditionally we've had some capacity building initiatives that may involve in person with an instructor right there in front of you, but over time, and this has proved to be expensive sometimes. And there could also be sometimes challenges with making reference to your either your old training notes or having a simulation of what the training was like. But now in this current age with the digital tools and the advancements that have been made in technology, the opportunities to take advantage of digital technology to enhance how we build capacity. Of course, there are issues around e-health where you may be able to use computers and the internet as a whole for these capacity building initiatives, but there are those that may then leverage also on smartphone technology or generally mobile devices through some form of mobile app to deliver these technologies. But there are also simpler ways, and we've also tried to, we've used this in the past, particularly in Uganda, where we use SMS or interactive voice responses as mechanisms of providing some little highlights of information. So generally speaking, the significant appetite, particularly in the context of Uganda, given the number of times we have to sensitize people on different guidelines and so on. If we leverage some of these technologies, we can have content that is packaged in a training way for all sorts of things, including guidelines, policies, and so on. They can be readily available to health workers in a searchable way. You may not always have to read a whole guideline to pick out what you need, but if you have something that is readily available on a mobile device or on generally a computer-based item, or even something that you can use a pool technology for example, you can maybe send some questions via SMS and receive a response. Of course, there are also those opportunities for remote training, mentoring. You could talk about telementoring and things like that, where you have trainers either centrally placed in a place, for example, like Kampala or Ministry of Health headquarters, and are providing training to colleagues across the country. This is also something that we are looking at, and it is something that Uganda is currently channeling some investments towards. So if you ask me that, do we have some strategies towards this? Like I said before, yes, our capacity, the capacity building component of our strategy that is currently in draft features digital technologies being leveraged for capacity building features very prominently. And this is something that we are taking very seriously. Thank you.
Thank you, Mr. Mbaka, for those insightful remarks. Now, gathering this backdrop on how integral digital technologies are in building the health professionals' capacity in the lower middle income countries, it leads towards gathering perspective from Cedric and Neil on what digital technologies would be most applicable or pertinent for lower middle income countries to build capacity for high health professionals. Cedric, over to you.
Thank you very much. I hope you can hear me. Good afternoon, colleagues.
Yes, we can hear you. Good afternoon.
First, I would like to thank the association and all the partners and colleagues who have organized this. And I think this is a very good topic for us to discuss, having had what Paul has just talked about. In terms of what Uganda has in stock for the strategy to move health services forward. But looking at our context as Uganda, one of the things that I would like us to separate is we have health professionals who are into service provision, but we also have health professionals who lie in the category of Cedric, who is a software developer or an information systems person, but his work is bent a lot into provision of health services, and that could be around doing analytics, informatics, and things like that. So when it comes to use of digital technology, we have technologies that apply in the different sectors for people who are on the front line, and then we have people who are, for us, who are into the information area or technical area for actually ensuring that these technologies work. But Paul has said it well, that some of the challenges that lower middle income countries face is infrastructure. And I would like to share some of the technologies that can actually work in lower middle income countries based on that limitation of infrastructure. And the other piece is also what we may call affordability, because infrastructure is one thing, but also for the users, for the government, for the partners to be able to afford the technology to deploy this, to deploy these digital tools is also another thing. So one, I would like to start with what we all know, and that's SMS. SMS, I think, is one of the cheapest, most affordable, and easiest technology to apply in empowering health professionals, both at the front line, but also in any other age. And I would like to take an example of a health worker down in Karamoja. One of the things that we cannot put our eyes over is that they do have a feature phone at the very least. So that feature phone can be a tool for them to receive information on training. So if you use approaches like mobile for quality improvement, you're able to set up questions on SMS, and if they respond to them, the information based on the responses that they have and how they interact with the SMS platform, you're able to gauge and see what knowledges they have about certain topics, and based on that, you can actually set plans on how to build their capacities as professionals. The second technology is what is coming up very strongly in most of the organizations, especially in the NGO world, and particularly I've seen it in the service world, and that's the use of call centers. Call centers are becoming quite popular in terms of enabling access to information to clients. But now I think it also comes through to be a potential tool that can be used to actually empower health professionals. I'm imagining a platform that is available for health professionals to simply call in and seek for additional information or seek for answers to particular questions or areas that they are not conversant with. That is a tool that is easy to use, especially for people, for health professionals in our context. And the examples I'm applying are a bit extreme because once we are able to craft, to get it right in the extreme conditions where we are challenged with maybe internet connection and sometimes signal reception, we are able to get it right now, even in other areas that are infrastructurally built. In relation to that, interactive voice recording, and I'm sure some of the participants here in the audience may be familiar with this, where people call in and it's a set machine that has a set of responses that you key in and keep listening to the information that you need. For me, these are easy tools that do not require very sophisticated gadgets and tools to be able to use and access information and improve your skill as a health professional. We've also, in this pandemic, we've also seen a number of our partners and even other individuals try teleconferencing and video conferencing as a tool to be able to build capacities of health professionals. I've personally followed up on some of the trainings that have happened in the field on COVID prevention over a video conference. However, the challenge there has been, of course, internet, but in areas where we've observed that there is good signal reception, this has really worked well. But also the other thing is that where health professionals are not able to afford the cost of the internet, that then would pose a very challenge. And I would like to end my contribution with a very controversial, I don't want, the controversial is a bit extreme, but social media. I can predict that in the coming years, some of these tools in low middle income countries like social media will be spaces for us to apply trainings, apply use of information that can be accessed to empower these health professionals. Because one of the things that a person who gets a smartphone wherever they are, it doesn't matter whether you're in Kampala or you're in the city or you're in the village, the first things that someone who has a smartphone gets onto when they get a smartphone is social media, WhatsApp, Facebook, wherever. So my prediction is that as we go along, digital tools, digital social media tools like WhatsApp and all these others, or even Facebook at some point, will be tools where health professionals can seek for information. Of course, we have continued controversies because you have a lot of noise. I like to call it noise because everyone posts on social media what they like, and then in health, where we have a very controlled environment, you always want to have professionals access very credible, synthesized, and approved information that they can use. But I think with continued improvement, there will be spaces where actually this synthesized information and well-approved and accredited information can be available for health professionals to be able to access and improve their skills going forward. So those are some of the tools I can share for now, which I think that are very applicable in our context as low and middle income countries. Thank you very much.
Thank you, Cedric. Understandably, the maturity readiness factors have a significant role to play in the sustainable uptake of capacity building technologies. And with that in mind, it would be interesting to learn on what it would take for lower middle income countries to use digital technologies in building capacity. And here we'd like probably to hear from Jamiru from WFP on his insights. Jamiru, welcome.
Thank you very much. Good morning, good afternoon, and good evening to all those who are attending today's webinar. Thank you for attending. And the topic is actually of great importance because there is great need. I'll start with an example that earlier this year in January, before the lockdown, WFP and 4 other organizations, we conducted trainings, classroom trainings across over 800 health workers within one of the regions in Uganda. And in April, we ran a small assessment in 2 districts out of the 9, and we found that there had already been a 30% attrition. Most of the health workers had left, and some who were new were not aware of the protocols that had been trained on. So you can see that money was spent, but then within a short time, we don't have results. And then we need to adapt and adopt new approaches, such as digital technologies for capacity building. However, before we go into the adoption of the digital technologies, you find that there are several issues and several factors. Good enough, Cedric has laid out the various examples of the technologies we can use. However, there are still lingering issues on ground that still needs to be strengthened. Some need to be put in place. First and foremost, governance is one of the key issues at national level. Governance and also to make sure that all this is moderated, the methodologies are regulated, to make sure that the information that is put out there is correct and actually checked by the various authorities needs to be put in place. But this also shouldn't stop at national level. It should also go to the subnational levels, because many times we develop very good documents at national level, but when you go to the district, they're in another world and they have no idea of what's happening. Well, the only way they get this information is through a small memo, which goes, and sometimes it causes confusion because they don't know where to start. They don't know about the various guidelines and policies. So governance in general, putting controls in place is something that will set the landscape as we get ready for digital technologies to support capacity building of the health workforce. Training is something that seems obvious, that everyone, we think, sometimes we think everyone knows how to use a smartphone or everyone knows how to use a feature phone, but you'll be surprised. Even something which many people thought is simple, like a touch screen, can be complicated to some of the health workforce, especially the frontline. So training and training and training is something that we need to put into consideration as we use some of these technologies. Some of them may look obvious, but they're not so much obvious to some of the communities. And of course, stressing infrastructure as part of the readiness. Infrastructure is something that is important. Infrastructure means the devices themselves. Depending on the technologies we health workers can adapt, they are dependent on some of the devices. Good enough Cedric has well elaborated that. Power issues are still a problem in some of the districts which actually need these trainings. So some of the districts don't have power even to charge a simple phone. When it comes to internet connectivity and even the network connectivity, there is an issue. If you visit one of the regions, like for example, Karamoja, you go to one of the health facilities and you find a tree has bottles with their phones. That's where they hang them to pick network. So even when they reach reporting, the weekly reporting on M-Track, they have to take their phones to that tree or stand under that tree to be able to report. So even simple technologies which look simple like SMS can be hindered by some of these infrastructure challenges. But most so, the leadership and the buy-in at national level to at the forefront can also help a lot to make sure we are successful as we push the agenda for the digital technologies in building the capacity of health workers. So I conclude by saying that, yeah, this is a great need. However, we must be aware of the landscape which we are operating in and make sure that we adopt and also adapt the different technologies to make sure this is a success. Over.
Thanks, Jamiru. So once we have these maturity readiness factors well understood and addressed to the best of their ability, and now looking at implementation, let's assess on what are the anticipated bottlenecks, opportunities that may be foreseeable in the use of digital technologies in building capacity of the health professionals, and how these bottlenecks can be addressed in promoting uptake and sustainability. If you're to narrow down this conversation to Uganda specifically, Nassan Natseri from WHO probably can provide us with some of your remarks on this.
Thanks, Sheila. Can you hear me?
Loud and clear, Nassan.
Good afternoon, all, and thanks to my other panelists for setting the stage. In a way, they have touched on more than half of what I would have liked to mention in relation to this question, but also thanks to the association for nominating me to make a contribution in this month's webinar. Hopefully, we will generate quite an amount of information that should feed into informing the sector. Now, in terms of the challenges that the country may face in starting to implement, start adopting these digital health technologies, one is infrastructure. That's a big one, both in terms of the devices, but also in terms of the network itself. Though as a country, we have made a lot of progress. There was a time when you'd go to a part of the country and there wouldn't be any network, or there would be one of either the many network mobile telephone networks that we had. But for now, I think we're well covered. So the penetration of mobile telephones is quite good, though that won't rule out some parts of the country that are still starved. The other is going to be the literacy of our health workforce. We would like to create a digitally literate health workforce. Jamir has already highlighted that there are things that look obvious. He pointed out the smartphone or just touching that device. But it's interesting when you get down to the actual work that then you find somebody fidgeting. So we need to build a mass of health workers that are quite proficient with these devices and how they can navigate around these so that they are able to exploit the full potential of the solutions we are bringing out there. The other is the challenge of a legal and regulatory framework. This is very key. We need to have we need to have this right from the top, right from the central level, from the Ministry of Health downwards to the districts, well articulated, so that introduction of new technologies is harmonized to what the general objective of the HSDP is, so that it ends up contributing to health for all within the sector. Fortunately for Uganda, we have started initiatives in this direction. Currently, because of the pandemic and the lockdown that ensued after that, efforts that had started to develop the health information and digital health strategy, which Paul mentioned initially, had sort of stalled, but these have now been revived. So there's that good chance of having this strategy out and to guide generally work that will happen within the digital health area. There's also a global digital health toolkit that WHO and then the UN General Assembly plus the regions around us have developed. There's a draft dated the 5th of July, which is out there. It's a draft for now, but well articulates the issues in this area. The country can pick this up and see what we can adopt as Uganda. The other, in terms of addressing the challenges that ensue out of this, is reprogramming existing funds that we have within the sector for maintenance and periodic updating of operating environment. The funds could be elsewhere. We just need to nicely basket these somewhere so that they are available to support this big ambition that we have. The last one that I wanted to highlight as part of what Uganda can do is M&E, to establish a monitoring and evaluation model which can facilitate the monitoring of the contribution by the different systems. And how are the health workforce processes, how have they improved, are they getting worse off, the individuals and the community needs. Just to give a figure here, some of you could have heard of a health facility assessment that we call SARA, Service Availability and Readiness Assessment. The last one was done in 2018. So facilities are sampled across the spectrum of healthcare, so from regional referral hospital all the way downwards to health center too. So in the last one that was done in 2018, 82% of the facilities had a power source. And the power source was either the main supply or presence of a generator or the presence of solar panels to make available solar generated power. So 82% of the facilities had this, which is a good one because the expectation was this was much lower. Then the other that is quite low is facilities that had internet connectivity. A computer with internet was just 26%. But those that had some form of communication equipment, it could be a radio call, it could be a phone, those were 48%. But now when you combine that with internet connectivity, only 26% of the facilities had this. So you can see that we're dealing with a huge gap. even as we think about these solutions, that the uptake may be challenged by the presence or absence of this, we call it fertile environment to absorb the benefits of the technologies. Thank you, moderator, for now. I'll get back later. Thank you.
All right, thank you for that. And now, before we give a chance to the audience's inquiries as they keep flowing in, I'd like to give a chance to Moses Bagendera to share with us some of the success stories that have been experienced from other countries in the spirit of collaboration and continued learning that can be tabled in this conversation today. Moses?
Yeah, thank you very much, Madam Moderator and colleagues on the panel, ladies and gentlemen, and thank you for the invitation given to me to contribute to this noble cause. I wanted first of all to make a disclaimer and say, I think when we talk about digital technologies and the capacity building for health professionals, the major goal is to improve efficiencies in the delivery of basic health services to the citizens. And of course, when we talk about technology, a lot of efforts have been made to ensure that it is driven by need-based and evidence-based, or what I could call technological pull, rather than technological push. What I'm trying to mean is we don't just co-opt technology because we need technology, but it should be on a pull basis to make sure that there is efficiencies for our capacity of health workers, and also the services that they offer to the citizens. So those of us who have read the Global Digital Health Index 2019, and basically this is an index that looks at countries, the developing countries and the developed countries, and Uganda participated, and Ethiopia and Tanzania. It came up strongly that most of the African countries, Uganda inclusive, they are still low on the maturity models or maturity levels. Jamie talked about governance, leadership, technology, and also HR. When you classify them, they are still at the start line, majority of them. So when we talk about success stories, I would want to look at some regions that have done well with human capacity building using digital technologies. And I choose to look at, for example, the Southeast Asian region, if you classify that one according to the WHO. When you look at countries like Bangladesh, Bhutan, Democratic Republic of Korea, India, Indonesia, and Sri Lanka, Thailand, and others, there are things that they have done in common as a collaboration that enhance the building of capacity, health capacities using digital technologies. You would realize that in this block of countries, they have developed digital policies, strategies, regulatory frameworks, which correspond beyond boundaries to support the national health systems. So it is very, very important that we must have the regulatory framework. Do we have the policies, the strategies, and we always link this one to the WHO toolkit, which we know that promotes digital policy. All these countries have had documents that, or frameworks that guide the implementation, but also looking at human capacities. Then secondly, if I look at this block, they have a coordinated investment in ICT, in health, with an overarching plan for e-health in individual countries and regions, also looking at what promotes the capacity of human resource. In other words, it is a are coordinated across board. So for the case of Uganda, I would look maybe about East Africa. Do we have a coordinated investment? Are we using and reusing technology? Are we able to look at open standards, open source, so that we are able to look at this as a block? Again, I think they promote a high degree of cooperation, collaboration, and sharing across all sectors to iron out issues of duplication. I think the issue of duplication also affects a lot as we look at some of these countries, what they have done to build capacity. And then the other thing that comes out strongly is harmonized e-health market across levels within these countries, looking at technology, but having specific investment on their human resources. A case for Uganda, for example, when you talk about human resource and technology, you realize that it is not well cascaded to the lowest level. For example, when you go to the district level, when you go to the hospital level, regional referral hospital, or hospital at the district level, or health center, for how are we building these capacities? Do we have human resources that have been built to handle the delivery of systems or health services using digital technologies? So that is a big challenge. Where do we invest? It is very, very important that we harmonize and we purposely decide or plan to do investments at all those levels. I think Jamie talked about communication infrastructure. It is another important thing. Most of these regions that I've talked about, they have harmonized and they have improved communication infrastructure, talking about things like broadband connectivity, internet access, and at reduced price, and also last mile connectivity for health workers. A case for Uganda, you find that there is a broadband going along many towns. Have we thought about the last mile solutions to cater for our professionals? That is another thing that has worked well. And of course, you know, when there is a deliberate effort to work as a block, it helps to reduce the costs. But also, this block, the South Asian countries, they promote cooperation between potential stakeholders within countries, within the region, so that there is more understanding of digital health, but also how they can benefit from it at a low cost. Looking at things like mobile technologies, telemedicine, EMRs, and so there is a grand cooperation so that what has been tested or piloted in one country is rolled out in another, so that we use and reuse technology instead of issues of being creative all the time, developing tools that are used across board. But it is very, very important, as I conclude, that it's not just about rushing for digital technologies, but at looking at how these technologies can improve service delivery. Over to you, Chair.
Thank you so much, Moses. And picking from your last comment to welcome the questions that have flooded in from the audience, I'll start off with one that has come in related to acceptability. And this is towards Paul Mbaka, probably a minute just to expound on whether digital learning has been accepted by healthcare providers, now understanding the Ugandan context. Mr. Mbaka? All right, probably you may be on mute, but as you prepare to respond to that, I'd like to proceed on to the next question that came in. the question was around governance and regulation on what are your overall views on the need to collect, amalgamate digital technologies, especially in the health sector in lower middle income countries. So this is talking about the level of regulation in Uganda now, if you could provide a context to that. I would like to send this question over to Nasan, given speciality in M&E.
Hello.
Yes, Nasan.
Well, Paul in the beginning did mention that with the virtual meetings going on, one of the threats is that of internet connectivity. I didn't know that during this same virtual meeting he would fall a victim of that. But back to your question, in terms of the legal and regulatory environment within Uganda currently, as I did highlight in my presentation earlier, it's been sort of ad hoc without a strategy, and has been guided in part by some technical working groups. We used to have an e-health technical working group that would give overall direction and technical advice on the direction of some of the innovations that would come up. This TWG has now changed name, but that's not important. So we had that, and then we had other four as well. But as we speak, we're having two strategies coming up. One is the health information and digital health strategy. That's the big one, and we're looking forward to that. There was one earlier, which was the e-health policy, which had gotten to the point of being discussed at cabinet level. And then once that is passed, that should also be quite an addition to this space. And then efforts currently are going on in the area of harmonizing standards. So we have the Health Information Exchange as well as the enterprise architecture. These are currently going on. They were a little slowed down because of the pandemic, but we are back at it now. Hopefully we should get to the end of this and have these documents out, because these guidance documents should be able to help in what we do as a sector. Thank you, Sheila.
All right, thank you so much, Nasan. Just trying again, probably Paul, if he's still available, on whether it's possible to share any, or if there's any documentation on best practices that have been taken up. Hello, is that Paul?
So that is that we're working on. I have reached out to the
I'm here, but you're breaking up. Could you just finish off on that last part?
Yes, on whether you have any documentation on the best practices on digital learning from the Ugandan perspective.
The technical team trying to, so that we can reach a
okay, thank you very much. We do not have a document on best practices, but we have done, we did an assessment last year. And the assessment report can be shared. That can be arranged. Thank you.
All right, thank you so much. Understandably, there are some questions that keep on coming in, but the panelists have tried so much to respond to them. And being cognizant of time, I'd just like to thank the panelists for that interactive session. And just to mention the key highlights that have come up from this discussion, which is leveraging digital technologies such as SMS, call centers, social media channels in bridging the gap that are being faced by the constraints presented. Then there are readily available implementation frameworks that can be adopted and contextualized for implementation in any lower middle income country setting. And lastly, that these digital technologies for capacity building would need to be designed on a full intervention that it needs basis meeting the needs of the clients. So with those few remarks and concluding that particular session, I'd like to pass the baton back to Carol Kamasaka to take it from here. Thank you so much.
Thank you very much, Sheila. That was very wonderful. And our panelists, we appreciate your discussions and support plus contribution to the webinar. We haven't been able to answer all the questions due to the limited time. We have about 8 minutes to end. We are going to have these questions answered and posted on our website. We'll share the link briefly to our website, but also if you want to join the association, kindly visit our website. Allow me call Mr. Tom Oluch, who is the president for HELINA, to give us some closing remarks. Tom, you're welcome.
Thank you so much, Carol. And thanks so much to all the panelists for the great presentations and the great discussions and the questions. So as Carol said, my name is Tom Oluch. I'm the current president of HELINA. HELINA stands for the Health Informatics Network in Africa. And it's the African regional representation of the International Medical Informatics Association. So as the name suggests, I mean, we work with different member societies in Africa to promote digital health. And Uganda Health Informatics Association is one of our newest members and has been a very active member, as you've seen, I mean, in the series of webinars that they've worked on and trying to bring people together, or health informatics professionals, to find a forum to discuss, to collaborate, to share information, exchange experiences, and so on, like what's just been done today. Sorry, I almost said this morning. Sorry, it's morning my time. So I think this has been a great topic, use of digital technologies to build capacity for health informatics professionals in low and middle income countries. And in particular, what I always say is that COVID has been a very challenging public health issue and continues to impact our lives in many different ways, impacting our culture, impacting how we conduct business, and impacting our day-to-day life in general. But it also has opened our eyes to some potentials, especially in digital health or digital technologies, that we hadn't thought through previously. And I think moving forward, things will not be exactly the same. Even if a vaccine is found or treatment is developed as successful, some things have just changed permanently, especially in digital health. And so some of the discussions that the panelists shared, or experiences that were shared, and some of the thoughts, especially on things like capacity building opportunities, how we leverage digital technologies for distance learning, for online learning, and for like even training of frontline healthcare professionals, and even things like continuing medical education and so on. A lot of CMEs have now being conducted online using digital health tools. And so these are things that are almost going to be permanent changes. There's still need for social interaction as we are as humans, but digital technology has showed us that we can do things differently and still maintain the same quality and standards that were previously achieved in the traditional methods. So again, I just wanted to really appreciate the Uganda Health Informatics Association for bringing all of us together for this discussion. And thank Carol and all her colleagues in Uganda for all this work. And all the presenters, I just want to congratulate you. And we just also to mention that we have the upcoming HELINA conference, which, as you know, is being hosted this year by the Uganda Health Informatics Association. And it was supposed to be in Uganda later this year, but again, because of all the travel restrictions, the COVID-related issues, we are postponing it to March next year. So the announcement is going to come out shortly, and we encourage as many of you as possible to register, to submit abstracts. I still see some familiar faces here from last year's conference. Living Goods had very good presentations at last year's HELINA conference in Gaborone in Botswana. So we do hope that many of you as possible will register, will submit abstracts, and will plan to participate in the HELINA conference, which is now scheduled for Kampala in March. I think it's 23rd through 25th of March next year. So with that, again, I just want to thank you so much, and returning back to Carol. Thank you very much.
Thank you, Tom, for those remarks. I want to thank all of you for attending our webinar today and for being a very good audience. We have suggestions to have it last for about 1.5 hours the next time, and we shall have that considered. Thank you so much. We have come to the end of our webinar. Please visit our website and join the association, but also for other content that is on the website. Thank you very much. Have a beautiful weekend.
Thank you.
Thank you very much.